Hello, everyone. Welcome to our third HOPA Town Hall on Wellness and Burnout. My name is Heidi Finnis, and I'm your 2022 to 2023 HOPA President. I'm pleased to be here today to introduce you to our speakers, Gerald Villadolid, Kate Reichert, Allison Goldbach, and Allison Golbus. Before I turn it over to our excellent speakers, I want to be sure you all have marked on your calendars the HOPA 2023 annual conference at the Phoenix Convention Center in Phoenix, Arizona on March 29th through April 1st, 2023. Early bird registration is at a discount right now and is open until January 29th. Regular registration fees will start on January 30th. I also want you to know that HOPA has $6,600 travel grants available to you to help you attend this conference meeting. Travel grants require an online application, curriculum vitae, and letter of support from your employer, but they're due by this Friday, January 20th. At Annual Conference 2023, our Annual Conference Programming Committee has planned a Precision Oncology pre-conference program in 37.25 hours of continuing education credits, including 8 BCOP credits. Updates on our 2022 to 2023 HOPA ASCO Quality Training Program and our advocacy initiatives will also be available, as well as a reception for committee members, a specialty interest group luncheon, posters, and so much more. Be sure to attend our John G. Kuhn keynote address entitled, "I'm Not Limping, That's Swagger," by Kelsey Tainch, a patient advocate and two-time pediatric brain tumor and stroke survivor. I hope to see you in Phoenix for this excellent programming and network opportunity. And now I'll turn it over to Gerald, the chair of our Wellness and Burnout Task Force.
Thank you, Heidi, and thank you so much to everyone joining this call. We truly appreciate your time and all that you do for our oncology patients. My name is Cheryl, and as Heidi mentioned, I am the chair of the HOPA Wellness and Burnout Task Force. I'm currently a medical science liaison in community oncology and recently switched over in February 2021 after 10 years in the hospital setting as a solid tumor pharmacist. I'm really passionate about well-being initiatives because I believe in the value that we bring to our healthcare team. And I feel that incorporating well-being as a priority will help us have a sustainable workforce where we can be the very best for our patients. So throughout this town hall, we hope to acknowledge that our hematology oncology pharmacists within HOPA are experiencing burnout and review key results related to 2 national surveys within the Hematology Oncology Pharmacy Group. We want to introduce our new HOPA Wellness and Burnout Task Force and a few of our first initiatives, but most of all, we really want to hear from you and gather your feedback so that we can ensure that the initiatives from our task force really meet the needs of our members. So we'll have interactive polls throughout the town hall for you to participate in, as well as time at the end for questions. And feel free to type in the chat as we go. We definitely want to hear from you and again, get your feedback on some of our initiatives and ideas. So if you could go to the next slide. As Heidi mentioned, we have a few speakers for this town hall. We have our Vice Chair, Kate Reichert, and Allison Goldbach, who conducted the 2021 HOPA Burnout Survey for our members and identified the high prevalence of burnout within HOPA that led to the development of our task force. We also have Allison Golbus, who represents the Oncology Workforce Survey Group. Their results were presented at a recent HOPA practice management meeting and were also highlighted in our most recent HOPA news edition. Their follow-up survey link was sent recently, so if you've received that, please complete it, and we look forward to reviewing some of the data with you. But before we turn it over to Allison Goldbach to start off with our burnout survey results, we wanted to first poll the audience. So if you could go to the next slide. We wanted to get some quick demographics so that as we get feedback from the audience, we know what types of members are on this call and where the feedback is coming from. So our first poll question is, what practice setting are you currently in? We've got hospital, ambulatory industry, academia, managed care, and other. And let's see the results. Okay, So it looks like 29% are in the hospital setting. We've got 35% ambulatory, 6% industry, and 29% other. Okay, so great diverse group within our audience here. Next poll question is about your practice experience. So the next slide. How many years have you been in practice? So we want to make sure that the initiatives we have towards well-being really apply to all of our membership, from early stage training to established career. So we have a range here of 0 to over 10 years. If we could see those results. So we've got 51% of the audience members over 10 years. So that's great to have such established pharmacists on the call. And I think with that over 10 years, you've seen a lot of changes with our workforce and can provide a lot of feedback as to what works now as opposed to before as we're changing in our profession. So thanks for interacting there. Last poll question for demographics before we go into the studies. What is your current role? Staff pharmacist, clinical pharmacist, manager, supervisor, director, professor, or other? And we'll see those results. So it looks like 52% are clinical pharmacists, and our next highest group is manager, supervisor, director. That's helpful because we hope to provide leadership resources as well. So you can move on to the next slide. So as I mentioned, we'll start by reviewing national survey results related to hematology oncology pharmacy. So we'll start off with Allison Goldbach to review the HOPA evaluation of burnout, which is a survey sent in 2021. Allison?
Thank you so much, Gerald. Similar to the diverse group of folks participating in our town hall this afternoon, there was also a very wide variety of pharmacists who took our burnout survey. This survey was distributed to HOPA members back at the end of 2020 with the goal of determining both the prevalence as well as risk factors associated with burnout. Burnout is such an important subject due to its association with various mental and physical health conditions, some examples being anxiety, depression, heart disease, and headaches. Additionally, various studies have shown burnout's negative association with job retention and medical errors. Overall, we found 61.8% of pharmacists responding to the survey reported high levels of burnout. And this was determined based on their Meloche Burnout Inventory, or MBI score, which is the gold standard for measuring burnout. Next slide, please. As mentioned, there was a wide variety of pharmacists who responded to the survey. This slide shows a few of the job characteristics and demographics that were collected via the survey. 65% of respondents worked in direct patient care roles, which was the most common amongst participants. The most common work locations were inpatient and ambulatory settings, and we also had representation of pharmacists working in other settings such as academic medical centers, administration, and infusion centers. In terms of disease specialty, we saw similar numbers between hematology and oncology-focused pharmacists. Overall, about 69% of pharmacists responding to the survey held BCOP certification. Along the right-hand side here, you can see the average age of the HOPA membership versus the respondents to our survey, which was similar at 40.7 versus 37.7 years respectively. Below that is a breakdown of years of practice, which was also similar between groups, showing that the survey was a good representation of the HOPA membership. One of the key takeaways from our survey was the association between high levels of burnout and pharmacists' intent to leave their current position within 2 years for reasons other than retirement. 60% of those with high burnout versus just 19% of those without high burnout. Next slide. In the multivariate analysis that we completed, we were able to identify several risk factors associated with an increased level of burnout. A few of these included increasing age, more hours worked per week, and more administrative hours worked per week. We found that pharmacists were 4 times more likely to report a concern for having made a major medical error within the past 3 months if they were experiencing high levels of burnout. Those who were unaware of wellness programs available to them were also over twice as likely to report high levels of burnout. The information that we gathered from the survey led to HOPA's collaboration with consultants to help develop and create well-being initiatives, as well as a HOPA Wellness and Burnout Task Force that you're meeting today on our town hall. And with that, I'll pivot back over to Gerald for some additional polling questions.
Thank you for reviewing your data, Allison. So we thought that since we have a large group now, we wanted to poll the group about our burnout today. So next slide. Our next poll question, are you feeling burned out at this moment in time? I know that we've got a lot of momentum going into 2023, and 2021, when the original survey was out, was in the middle of the pandemic. So just curious to see how everyone is feeling today. And you can go ahead and show the results. Okay, so 63% said yes, 38% said no, which I'd say is pretty close to the 2021 results that we had. So consistent, even though there has been some time that's passed. So now we can move on to the next slide. So as Allison mentioned, one of the key results is that many pharmacists did not know where to go for well-being resources. So again, since time has passed since the survey, we just wanted to poll the group while we have an audience, which resources do you get from which sites? So we've got multiple organizations listed here, ASHP, APHA, your specific organization or other. We can see the results now. Okay, interesting. This will really help us with our toolkit. We actually have an ASHP well-being member on our task force, which I'll highlight in the next coming slides, but ASHP has a very robust well-being website. APHA came out with a consensus conference statement, and then organization, I'm glad that your organizations are focusing on well-being at this time. So thank you for answering. And now I'll pass it over to Allison Golbis, who will review results from the Oncology Workforce Survey, which was also conducted in 2021. Burnout is just a component for reasons for attrition, but this is something that can impact our entire oncology workforce. So Allison, take it away.
Thank you, Gerald, and thank you to the Wellness and Wellbeing Task Force for inviting me to this. So similar to what Dr. Golbach presented for the data that she did on burnout, the workforce survey that we distributed in 2021, so that was distributed by Kamashki, Zara, and myself, had close to 600 respondents as well. 78% of our respondents showed that they were satisfied or very satisfied in their current role, but 60% indicated they were actively considering other careers or open to looking for other careers. And there's several reasons for this, and you can see this in the left-hand side of the slide where it goes through the graphs for reasons for attrition risk. So the top reasons for attrition are highlighted in the bar graph, and you can see here that it varied amongst different work environments, which are designated by different color codes on here. But burnout and work-life balance prevailed as top contributors toward attrition in addition to other factors. So we definitely still have to work on the burnout. Looking at satisfaction versus attrition, if you look at the table here in light blue, you can see that the respondents and patient care were significantly more satisfied, but also had a higher risk of attrition. And that's something that we need to really dive into a little bit more. And looking at attrition over time, which you can see by this survival curve, you can see that attrition starts as early as 3 years for a lot of people, especially in the clinical pharmacy workplace. It increases at the 5-year mark, and it really kind of falls off the cliff at the 10-year mark, which is also concerning because those are the people we need to help mentor our new pharmacists to the oncology workforce. Next slide. So with burnout and workforce balance being high reasons for attrition, we really challenge organizations to advocate, recognize, and support pharmacists and commend HOPA for being part of that. But at the institutional level, that needs to also be done. And those are things that maybe these toolkits that HOPA is coming out with will help to bring not just to the oncology pharmacists, but also resources for others. Staff need support for development, and we recognize that, and they want additional opportunities. They want to be protected in terms of the time they have to engage in professional activities and in professional development, which is what you can see here in the right-hand side with the bar graph on what it takes to retain staff. So these are affinitized comments that we found that show really the biggest areas are support for professional development, additional training, including BCOP, and protected time to do these outside core business engagements. Before we move to the next slide, I do want to remind everyone there was a link sent at the end of December by HOPA for our workforce survey part 2, which has a little bit more detailed questions. And one of the categories we do have in there is related to burnout, in addition to some of the other high impact areas that we found that people had as reasons for leaving. And we're delving a little bit deeper into each of those domains to find out more, to see what can be done for the future. So please, if you haven't taken it yet, please take it. It closes tonight at midnight Pacific time. Thank you. Next slide.
Thank you, Allison. I'm really looking forward to seeing the follow-up results. And I just want to thank your oncology workforce group to really put the numbers to some of those reasons for attrition. I think it's really valuable to have some of that data moving forward as we think of additional initiatives and resources we may need. So without further ado, I'd like to introduce our Wellness and Burnout Task Force. We have our Vice Chair, Kate Reichert, as well as our Board Liaison and HOPA President, Heidi Finnis. And I would like to say we really appreciate being able to work so closely with Heidi as part of our task force, because she's been very mindful about how to incorporate well-being as part of HOPA planning and really engaging members and leadership at every level. So we're really privileged to be part of this task force at its beginning stages, and we hope to continue with our well-being initiatives to match the needs of our members based on your feedback. So next slide. So this lists our task force members, as well as the HOPA staff that support our initiatives and collaborative representatives from other large hematology oncology pharmacy groups. And we really wanted to highlight all of our 13 task force members who are pharmacists in different types of pharmacy practices. So as you can see, we have pharmacists that work for insurance companies, the FDA, academic medical centers, industry. We're at all stages of our career, and we also wanted to highlight key roles so that as members watching this town hall, you have context now to reach out to if you are experiencing burnout or have experience with some of these roles and want additional insights or ideas. So just highlighting some of the key roles. Derek on our task force is evaluating burnout among pharmacy residents. So that's another national survey that'll come out that will highlight burnout. We've got a lot of leadership within specific organizations. Again, I mentioned ASHP as an organization that has a robust website. So Bethany is actually a well-being ambassador for that group. So that helps us connect to larger pharmacy organizations, even outside of oncology. Our HOPA staff has been very helpful in terms of keeping us on track, listening to all of our ideas, and helping us conduct this town hall. And then, as I mentioned, we have collaborative representatives. So we're in the loop about their individual well-being initiatives. I know that NCODA just had a session right before this town hall focused on well-being, and we hope to collaborate with these organizations in the future, whether that be a collaborative white paper to set more standards or other initiatives. We're happy to work together with these other organizations. Next slide. And then in addition to our key roles and where we practice, we also wanted to show that we're not just pharmacists. We have family, animals, other life things that we're proud of and that we can relate to with our HOPA members. And so again, if you're experiencing burnout or just want another friend, colleague to expand your network, feel free to reach out to any of us. We also recognize that well-being needs may change as life changes. changes. So this is a town hall to gather feedback on our initial initiatives, but we want to keep touching base with you all and keep hearing from you all so that we can continue well-being initiatives throughout. And next slide. So our initial task force charges were taken from some of the recommendations from consultants that were hired by HOPA following the initial results of Allison's HOPA Burnout survey. So those consultants looked at the literature, surveyed board members, and really made recommendations as to what they thought our members may need initially from a task force. So the first few charges, creating a statement, evaluating topics and framework of well-being initiatives to be incorporated within HOPA, develop and implement communication campaigns, build a toolkit for HOPA members, and then finally to collaborate with other pharmacy organizations. So we've done work towards each of those charges, but we hope to continue on. And I'll now introduce our Vice Chair, Kate Reichert, to talk more through the consultant recommendations in more detail.
Thank you so much for that introduction, Gerald, and welcome everyone to our town hall today. So as Gerald just mentioned, the results of the HOPA Burnout survey did lead to a collaboration with consultants to provide recommendations for wellness activities based on a comprehensive literature review and interviews of select HOPA leaders and members. So these consultants offered 50+ years of combined experience in organizational and leadership development, as well as stress research. The recommendations for HOPA were to create statements, integrate into existing work, create communication campaigns, develop new programs, and build toolkits. Our task force is very proud of the statement that was put out towards the end of last year that demonstrates the commitment of HOPA to its members to address burnout, which will be shared on a future slide. And as HOPA members, we all know that there is a strong framework of existing committees and programs that our task force is evaluating how well-being projects can be integrated into that framework. And now that the statement has been released, we are working on communication campaigns, including this town hall, to gather input from our HOPA members. And finally, we're investigating development of new programs, and Gerald has some exciting updates on building toolkits later on. Next slide. So during the interviews that the consultants conducted with select HOPA leaders, themes were identified for each of the 7 drivers of clinician engagement versus burnout, which are shown here on the left. These are workload and job demands, control and flexibility, work-life integration, social support and community at work, workplace cultures and values, efficiency and resources, and meaning at work. So taking both the data from the HOPA Burnout survey done in 2021 and the interviews with the HOPA leaders, the biggest drivers of burnout were workload and work-life integration. So now that we have you all here at this town hall, we would like to take this opportunity to hear from you to see which area do you feel should be our top priority. I'll give everyone a little bit of time to select their choice here. Okay, let's see those results. Okay, so it looks like the majority aligns with what came out of the consultant work. So workload and job demands and a few others are listed here as well. So thank you for selecting what should be our top priority. Next slide. So one of the first and top priorities of the task force was to put out a statement to acknowledge the critical need and commitment from HOPA to mitigate risk factors of burnout and support well-being initiatives. It highlights that the work of our task force will align with each of the HOPA councils, so professional practice, education, research, and advocacy. Our interventions will be aimed at individual wellness, and also our goal for workplace well-being is to encourage a positive and supportive environment for HOPA members. Our hope is that by establishing and maintaining well-being in our workforce, we can optimize cancer care and medication management. And with that, I will pass it back to Gerald so that she can share more information about the initiatives that the task force is currently working on.
Thank you, Kate. You can go to the next slide. So as you've seen with the charters and recommendations from the consultants, we have developed task force work groups to ensure that we can make progress and address each area. We have practice management to discuss metrics, ideas, and communicate with the HOPA POP BC committee, collaborations with other hematology oncology organizations. One opportunity there is that we are presenting burnout and wellness at the opening plenary at the ISOP symposium. We are creating a toolkit and eventually want to include a campaign for recognition and activities around the annual conference. Next slide. We've completed the statements that Kate just highlighted and have a website landing page for future resources. Our next priority is curating a toolkit specific to our members' needs, followed by a roadmap based on the feedback we get today and potentially a future collaborations white paper. Next slide. So currently our toolkit that we're developing is divided based on stage of career. Our curated sources will also include evidence-based literature to help support initiatives you may consider at your institution. We also have a leadership management category, recognizing that not every pharmacist wants to become a manager, but for those who do become managers or leaders in their practice setting, they may need additional resources. Our website will also have a real-time wellness forum. So this is really exciting. It'll be similar to the HOPA Central Forum, where we currently have medical information, can ask each other questions. This forum will really help keep our well-being initiatives current and allow us to hear from you in real time and share ideas as a community. In the background with these toolkit ideas, we do have a shared documents project management tool where all of the resources that we will be posting are listed so that we can keep track and reevaluate on an annual basis. We can also collect information from the website to see the traffic that each site gets. So this will also help us stay up to date and evaluate whether or not to keep or update specific resources. Next slide. So the consultants that we worked with did identify a wide range of resources and ideas based off of organizational and individual toolkit needs. You can see the amount of research that they put into what should be going into our toolkit. And as I mentioned, other organizations already have robust well-being resources, but some may not be as specific to hematology, oncology, pharmacy. So we don't want to duplicate any resources that are already available, but we do want to curate resources that we feel may be most useful to our members. This is where we definitely want to hear from you. So this goes into our next poll question. What percentage of our toolkit would you like to see for personal versus organizational tools? So you've got equal 50-50, a higher percent with personal, lower percent personal, no opinion. Now we can show the results. Okay, so there's a mix. The majority is a lower of the personal well-being, a higher percentage of organizational resources. But I do like to see that there is a mix there of personal and organizational, so that does match the recommendations from the consultants that we had. Okay, so next slide. So with our diverse task force, we wanted to gather some example practice ideas that our task force members have already implemented or tried out in their current practice settings. So some examples of personal well-being ideas are listed on the left-hand side. And then for organizational, we've heard a lot about different innovative practice models, carving out admin time, understanding that some pharmacists may be able to work remotely now, having quiet time or digital detox. Some organizations now support apps like Calm or Headspace. And then wellness leave has been incorporated to some organizations, which allows pharmacists to have more personal time. So these are just some example practice ideas. I think with our real-time wellness forum, we may be able to ask about those practices in more detail and have more ideas and listen to how other pharmacists are coming up with creative practice models. Next slide. We wanted to give resources for implementation for more organizational focused well-being initiatives. So I'm going to highlight just a few of the links here. The first is a well-being index that was utilized in Allison Goldbach's survey. There's also the second link there, pharmacy department well-being programs. My former colleague Kelly Pillinger actually conducted surveys with an entire pharmacy department utilizing the well-being index to then create well-being programs and reassess with the same measurement tool. The cost of burnout, those three links are more physician focused, but could give you ideas in terms of measuring the cost of burnout as well as the return of investment to well-being initiatives that are implemented. We wanted to highlight the workforce stay interview from ASHP. It's a great standardized way to have difficult conversations about what may or may not be working at your organization and utilize the same standard template to follow up as well. There's also career coaching available that is sponsored by pharmacists, as well as articles related to having dedicated staff specific to clinical wellness and pharmacy. Next slide. So this brings me to our next poll. So we know that many of our HOPA members are also members with other organizations. And as these organizations also have well-being initiatives, we wanted to make sure to keep in touch and be mindful of what you all may be seeing for well-being in other places. So what other hematology oncology organizations are you involved with? ISOP, NCODA, ASTCT, ATAP. Now you can show the results. Okay, so it looks like we have a lot of heme pharmacists on this call, 71%, but a wide range of membership here. And like I mentioned, we do have contacts with all of those organizations to make sure that as we implement well-being initiatives, we can have the same messaging and work together where we can. Okay, next slide. So one of the other initiatives that we're working on is creating an example roadmap. On the left-hand side of the slide, you can see ASCO's Wellbeing Task Force roadmap, where they have specific initiatives as well as timelines. On the right-hand side is an example from the consultants we hired on what we should be working on. And we've already accomplished the first two, where we've assessed the needs and burnout of our members and created a statement. Right now, we're on step 3, which is well-being programs, and 4, which is implementation and communication. But we wanted to, again, touch base with our members, have this town hall to really hear your feedback so that we can ensure that the next steps on our roadmap really match our members' needs. So next slide. So now we're closing out the town hall. We have just a few more slides with resources towards the end. But again, we want to hear your thoughts and comments on our initiative so far and what you'd like to see from the group. Next slide. Last few resources here. These are all linked out and will be distributed via an infographic so that you'll have those links to click on electronically. So we've got ASCO highlighted here. I mentioned their roadmap. They also have a resilience skill training program. APHA has their Wellbeing Resilience Report. They partnered with other pharmacy organizations like ACPE and ABP to create a consensus statement with 50 recommendations in their report. ASHP has a very robust website, and then we've included some physician well-being websites at the end as well from AMA, ACP, and NAM. Next slide. So then our last slide here, while we close it out before we go to the Q&A, is a word cloud. So before you type in anything, I wanted to give some directions and give some ideas and examples. So with this word cloud, you'll have to text HOPA events 289 or 22333 to join in. And basically, we want you to describe in 1 to 2 words what our next step should be. So some examples could be white paper, metrics, recognition, provider status, CE support, annual conference, again, 1 to 2 words. We've had a lot of ideas from our task force, like book clubs, podcasts, fun runs, anything you think should be our next priority. Please type it in and text it to us and give us your ideas. This will help us identify any trends. And if there's not one specific trend, we can at least utilize those words to discuss at our next task force. And just to close out before we get the results, again, thank you so much for listening. We do have a post-town hall survey where you can leave comments if you're not able to interact today. But we wanted to leave time for Q&A and discussion and hear about your well-being at your practices. So thank you again for participating. And we're looking forward to our next few initiatives with our task force. Really interesting to see this unfold. And I think with our theme of working on that increased workload metrics may help us. I know that our practice management groups have been looking at that, as well as our oncology workforce survey. There was a question in there about what would be a safe patient to pharmacist ratio. So I know there's work being done towards metrics. So glad to see that that's something that could be prioritized as well. Lots of mentoring, networking. I like how someone included pediatric. So Kate actually practices in the pediatric setting, and we know that depending on your practice setting, your needs and your workload may be a lot different. So always great to recognize those other patient populations that may require a little bit more workload. And feel free to submit questions via the Q&A section if you have any comments as well. We're hoping to hear from you. We're developing our roadmap based off of recommendations that we think will be useful, but we want to know that they're useful based on your feedback today. So feel free to type in questions via the Q&A section. I do see one question in there. It says, you mentioned some sites have implemented unique practice models to address workload, work-life balance. Do you have any examples to share? Our institution has struggled with having adequate cross-coverage to allow for more conference attendance or professional leave. That's a great question. I think it depends on what kind of practice you're in. I know that in my practice before I left for industry, we had a group who had a pharmacist who had project time. So in their rotation, they had a pharmacist who was on their project month, but was also the pharmacist who covered other pharmacists' comp days. So it was useful to have that dedicated time, but also we had a large group. So for their comp days where you get one before and after the weekend, it still ended up that they're on service a lot of the time. So again, it depends on your practice setting. Anyone from the task force on the call, please feel free to share. I left practice in 2021, so I can speak to some of the strategies we did during the pandemic, but some of the task force members who are still in practice may have more current anecdotes. Next question, any personal or anecdotal experience with pharmacists having a positive, successful interaction with pharmacy leaders when discussing workload and or time for other responsibilities? Great question. I think it's not just pharmacy leaders. I think hospital leadership as well needs to see pharmacy value. And I think that's where metrics come in, or even just reading the cost of burnout articles. I think that was really interesting because metrics are sometimes difficult to apply to all pharmacy practice settings. So the cost of burnout may be something that could be more universal by calculating that way. And again, anyone from the task force, feel free to answer, chime in for innovative practice models for the first question. Reading the next question here, are there other professions that have not experienced significant burnout? Perhaps healthcare can learn from best practices in other professions. Great question. I know that in my research, healthcare providers seem to have higher rates of burnout, but it was in other professions. It's interesting, you know, oncology is very complex, but other healthcare members actually had some higher rates, like those who are internal medicine or more generalists. So that's an interesting question. We can see more from other professions as we do some more literature searching for our next initiatives in our toolkit. Next question, institutions pharmacy leadership does not have any hem-onc experience. We struggle explaining why our clinical role may differ from other clinical areas and require different things. I'm hoping this toolkit could include some tangible items to show non-hem-onc administrators, or if anyone has experience successfully doing this at their institution. Great comment. I know that there are articles that I've read recently about the role of the clinical pharmacist. I believe with some of the oncology workforce survey, they kind of highlighted how our roles as clinical pharmacists have expanded to do many other things as our pharmacy landscape has changed. So we'll try to include some of that literature. And I think these questions, comments are great. I envision that these are a lot of the things that we'll see in our wellness forum that we'll have on our HOPA website. Did the burnout survey identify significant differences in burnout linked to demographics other than years in practice? Allison Goldbach, I guess you could answer that the best in terms of anything else that your burnout survey identified.
Yeah, so we did gather quite a bit of demographic information in hopes to see if there was some sort of difference. We did not find a statistically significant difference between all the different demographics. So we did ask about marital status, gender, age, all of those things. We did not find a statistically significant difference.
If I could just comment for a second, one of the things we saw in the strategic planning survey was a need for HOPA membership, specifically those kind of greater than the 3 to 5 years, to have mentorship opportunities. And that is something that is being discussed right now as to how we can better incorporate those opportunities for more professional support amongst others within the organization. So we want you to know we're hearing what you're saying and trying to help be sure that some of the things that we implement are meaningful and provide you those resources and that support that you need.
I like that executive summary comment that just went up. I think that's a great idea. I know that we talked about maybe doing a collaborative white paper that may be more detailed, but possibly, you know, an infographic with just the key items from this town hall and some resources could be a possibility to have a shorter summary that can come out more efficiently. One of the links on there for general pharmacy was based off of a consensus conference for recommendations towards well-being. They had a lot of detail on that, so that may be a resource that you may go to that's specific to pharmacy. Any other questions, comments? I think, Kate, you might have mentioned at your institution, you have some remote time. Maybe you can speak to some of the innovative practice ideas you've seen since you're still in practice.
Yeah, I can speak from our PEDS team's experience, but after the pandemic, we did identify that for certain clinic days, we are actually able to work remotely to support the clinic by either calling patients, using telemedicine, or incorporating admin days to work on things like prior authorizations, catching up on notes, and fielding questions from the team. So that has really helped with, our PEDS team in terms of that workload and work-life integration to have those clinic days that we do get to work from home remotely. I did also want to highlight, I'm not sure which question it was at this point, but, there is within the data, support that as oncology pharmacists, we do deal with significantly more open trials than other pharmacists. We have, a lot of new drugs being approved every year on a month-to-month basis in our space. So kind of using that potentially to take to management for the question that was related to, HEMONC specifically needing that support. So just wanted to highlight that from the data as well.
Kate, can I ask, how did you go back to your leadership after the pandemic, or since we're not really after, when things kind of came back to normal, to say we still need this time? Or how do you get that, administrative time in order to ensure people have time to complete and catch up on some of the tasks that they have?
That is a great question. Thank you, Heidi. So we actually have partnered with our clinical teams that we work with, and with the permission of the chiefs of those services, been able to maintain the admin day. We've kind of proven that we're able to be productive in terms of, like we said, all of those administrative tasks that we have to do, but also helping with guideline development during that time. And the nurse practitioners in our clinic were also very supportive of us being remote. They're actually still doing remote days since the start of the pandemic, which has helped with their ability to take phone calls more efficiently when they're not in clinic. So we were able to kind of partner with them to support that we would be able to maintain our efficiency and ability to do a few clinic days from home.
I've seen some practices just incorporate coming in an hour later or leaving an hour earlier, or whatever specified amount of time. And for some pharmacists and providers who've implemented that, it's really helped them take care of other life responsibilities in addition to work, like doctor's appointments and things like that. So they've really appreciated that flexibility. It sounds little, but it sounds like for those who have experienced that in their practice, it's made a difference. Great question about pharmacy leadership. Any information on burnout among those in pharmacy leadership and how that may be different from those in direct patient care? It looks like Allison Golbus is typing, but I'm not sure if I saw your answer. Allison, do you want to speak to your thoughts on that?
Yeah, I can speak to it. And in our first survey, we had a section for like admin respondents. So I'm not sure how people identified with that, but about 5% of people responded that was their role. And when you look at their reasons for attrition, I don't know if they were answering from a different standpoint or from the admin standpoint, but it was one of the higher reasons was work burden, burnout, and work-life balance, followed by career advancement and work schedule, remote work. I think the problem is not a lot of people get reached with this survey that are in leadership positions, and maybe surveys need to be sent out through different avenues, maybe through Vizian or other avenues where some of those leaders do tend to spend more time or get more emails from listservs that they read. So that might be a better way to capture some of the pharmacy leaders that maybe we're missing with HOPA or with social media or other mechanisms that we're using.
Thanks, Allison. One of the articles that I included in the resources was utilizing well-being index across an entire pharmacy department. And I thought it was interesting because as pharmacy technicians leave their jobs and pharmacists are maybe taking on some of their roles rather than working at the top of their license. So not just pharmacy leadership, but the whole department may be contributing to different levels of workload that can go towards burnout. So I thought it was interesting that they surveyed their entire department to address every group, not just one group. Any other questions, comments, thoughts on what we're doing so far? Any comments are welcome. We just want to hear from you. Thank you, Lori, for your comments. Thanks for participating. We appreciate you.
Well, on behalf of the organization, I would like to say thank you to Gerald, Allison, Kate, and Allison for their time and preparation for today. Thank you to the Wellbeing and Burnout Task Force of HOPA, the external collaborators that participate in this. And I think to Allison, Zara, and Kamashki, thank you for your work with the workforce survey. We're anxious to see the results of the second survey, and if there are other things we can partner with you or with other organizations to be sure that we are keeping a tab on our members and their wellness. Again, I hope to see many of you at the annual conference in Phoenix, March 29th through April 1st. Thank you all for being here today. We really appreciate it.